Hi, I'm Dr. Laurie Hiemstra, and we'd like to discuss with you today our paper, The Experiences of Canadian Female Orthopedic Surgeons in the Workplace, Defining the Barriers to Gender Equity. So what led us to this research? Well, with diversity, equity, and inclusion topics at the forefront globally, we felt that a methodical and directed effort to best understand and address the issues around the barriers to equity for women in orthopedics was needed.
Hi everyone, I'm Marcia Clark. What unanticipated problems came up and how did our team deal with them? The open responses to our questions were overwhelming and quite honestly beyond disturbing. The volume of the words and the passion and the voices of the responses really moved us. And the depths to which we were impacted by the words that we were given was really unexpected.
Hi, I'm Dr. Claire Temple-Oberly. Regarding what findings surprised us, two things really stood out. First, the response to this survey was remarkable. This highlighted to us that this topic really resonates with and is important to our female colleagues. This has also been significant to our audience when this work has been presented. The volume of responses spoke to the importance of this topic to all female surgeons, not just a small minority, as a pervasive problem within our specialty. Experiencing gender-based barriers is not the exception for a few, but rather the norm for many women in the specialty. Secondly, the type and amount of reported harassment and hostility was surprising, emanating not only from peers, but from patients and from nurses.
How should practitioners change their practice based on our findings? And if so, how? It is our sincere hope that orthopedic surgeons, and by extension, all those in the medical and surgical fields, should see that this is a deeper systemic issue and start having some awareness about it. Be curious, be open, ask questions. It's okay to start talking about this issue in the workplace. On a higher level, the profession needs to develop a deeper understanding of how these barriers are rooted in the culture of medicine and deeply embedded in our organizational systems. We can then explore how our systems might be adapted for a more inclusive workplace.
What remains the most important question unanswered by our study, and how do we hope to address it? Understanding the institutional, social, and cultural issues is the bigger question exposed by this study. We have uncovered some of the what, but digging deeper into the why and how is the larger topic to comprehend. For example, what is the origin of these barriers? Understanding this will be key to developing strategies for how we can dismantle them. Until we can create systemic change, there will not be a lasting impact for surgeons, for patients, or for society.